One. Okay, I hope that it's broadcasting. It doesn't show in Facebook, but I'm assuming that it's on. So, hey ladies, can you see something, John?
I'm gonna look. Keep talking.
Okay. We are using a third-party app so we can both be on at the same time for this live video. And I'm hoping that it's working. We had tested it out and I think it should be working. So I want to introduce Dr. John Thoma, and he is the owner of Infinity Spine Center. And he has absolutely changed my life in many ways. And today we're going to be talking about plantar fasciitis specifically. And I wanted to talk about my story about how I found Dr. Thoma and what he did for me. So I started having plantar fasciitis. I've had it a few times in my life. The worst was when I was pregnant with my second son. And, you know, everyone who has it knows how painful it is when you get up and walk. And I thought it was just because of the extra weight I was carrying from the pregnancy. And it did improve after I had my son, but then it came back. And it was absolutely affecting everything from, you know, walking at work and to exercising. So I really didn't know what to do except for my dad had got me one of those big boots that you can wear. It's like this big ski boot type thing with straps, and it keeps your foot like in a flex position at night. It's totally uncomfortable while you're sleeping, but it prevents when you get out of bed that absolute painful feeling of the plantar fasciitis that you feel like needles are driving up through your heel. That helped a little bit, but didn't eradicate the problem. And then I went to a podiatrist, and he said that I had to wear orthotics all the time. I couldn't wear heels again. And that I should do a cortisone shot. So I did do a cortisone shot, and that worked beautifully. It helped me be able to walk around all around Ireland. I went on vacation with my family. But then when I got back, and a few months later, when the cortisone shot wore off, my whole body started becoming inflamed. I was absolutely miserable. So I had a bounce back effect. It reduced the inflammation in my body, but then when it wore off, I had even more inflammation. And so at the recommendation of my naturopathic doctor, she recommended Dr. Thoma, and he absolutely changed my life. So will you explain your methods of healing or your experience with plantar fasciitis and how you know how to heal it?
So I actually had plantar fasciitis. It was before I ever went to chiropractic school. I was washed up, but trying to have a football career into my mid-20s, and just doing a ton of sprinting. And with that, just all the stress on the foot, and I did not know how to activate the muscles in my feet. That led to plantar fasciitis. And so I remember waking up in the morning and just having to take about 30 steps before my foot would get warmed up and not have any pain. And I had it for like 5 years. I had it pretty much 2 years into chiropractic school. And then we started learning about the muscles in the feet. And it just made sense that what we have to do is we have to shorten those the distances between the two connecting points of the fascia in the feet. And we'll show you guys an exercise for that. So then I actually ended up, I was here in Scottsdale. I was sitting in a sauna or a steam room in Lifetime, and I just sat there for 5 minutes doing this small foot exercise, contracting it. My foot was cramping, and cramping is a sign of deconditioned muscle. Healthy muscles don't cramp. And so I did it for 5 minutes, and then I woke up the next day and it was like 90% better. And so yeah, that's after that. I never had plantar fasciitis again, and started implementing it into the practice. And that's what we gave to Hillary. And as you guys know, Hillary's personality, she's whatever you give her, she's going to crush. So yeah. So what we'll do is we'll show you how to do this small foot exercise. It's in our video on Tuesday. I kind of came across as it would pretty much heal all plantar fasciitis cases. And I do think that it's going to heal most of them. I'm talking like 99% of them. If you have if you have super strong feet and you're able to actually make the connection from your brain to your foot, and you have hip issues or core issues, that can cause some plantar fasciitis issues. But if your foot is strong enough, you're going to be able to shorten the two distances between those 2 points. You're going to get pressure off that fascia, and your heel's not going to hurt in the morning.
So what are you saying? There's like a 1% or a small percentage that this might not help. Who would that be, or what circumstances?
Honestly, if you know how to develop the control and coordination of the signal from your brain to your foot, you're going to get rid of the plantar fasciitis, no matter how bad the rest of your body is, because all locomotion starts with the foot. And if your foot, if it doesn't lengthen the fascia, it's next to impossible to have any pain or any symptoms in your foot when you're doing that. I know I said if you have like core issues or hip issues, it may be an issue, but I know on Tuesday I said it's pretty much 100% fixed for plantar fasciitis. Mm-hmm. It is. Wow. If it doesn't help you, I highly recommend that you work with someone that actually knows how to test and see that your foot is actually functioning right and that your brain is talking to your foot. And if that doesn't work, then you got to look elsewhere. You got to look to look at the core, look at the hips. Those are like low hanging fruit. Are the core and the hips. But if there's like a knee issue, a meniscus issue that causes you to overly pronate, that can be an issue as well.
Right. So the people that would discover that aren't necessarily a podiatrist. It would be a physical therapist or a chiropractor like you who understands body mechanics and can identify that, correct?
Totally. Yeah, if you go to a podiatrist, what they're skilled at is looking at the foot. Let's find the dysfunction in the foot and correct that. Mm-hmm. Whereas like a chiropractor or physical therapist, they most of them tend to look at the entire what is referred to as kinetic chain. So looking at the lower extremity and even going up to the core and looking at how the rib sits on the pelvis.
Right. So in my experience with traditional doctors, they are treating the symptoms of the issue, and that's exactly what I got when I went to the podiatrist. He was treating the symptom, which was the pain, but he wasn't getting to the core of the issue or the cause, which was my I wasn't getting a signal from my foot and not being able to control the muscles of my foot to my brain. And so that's why you need to look for a specialist who, has a knowledge of the entire body, the kinetic chain, and why it would cause plantar fasciitis.
Totally. Correct? Even chiropractors and physical therapists have these Band-Aid approaches where they're taking like these scrapers, these gua sha tools, these Graston tools, and just scraping the tissue on the bottom of the foot. That's really a Band-Aid. Is it going to help with symptoms short term? Probably. And I actually any injury that I have, like I do a lot of soft tissue work on it, and a lot of times soft tissue work is just a Band-Aid. It's going to get you some pain relief, which I would recommend that over any kind of drugs that you would take. But it's the long-term fix is right here.
Okay. Right. And I see a comment, I have terrible feet. She had bunion surgery in the 70s that left her with partial numbness. She has plantar, I think this is Kim, plantar in both feet for a year. Worse, the right is worse than the left. She's been doing stretching exercises, but not regularly, I have to admit. Well, Dr. Thoma is going to show the small foot, and I will have to say you must do this consistently. If you do not do this several times a day, every day, it's not going to be effective like anything, but it will work.
Totally. And then a couple things. She said that she had the pain more on one side than the other. That's very common. It's not. It's more common for you to have asymmetrical symptom symptomatology on plantar fasciitis. And then the other thing that she said, oh, stretching. We actually don't want to stretch the foot. If you're doing stretches for the feet, I definitely would not recommend that, because it's the stretching of the fascia that's the issue, that's pulling on the calcaneus or the heel bone, which is where typically most of the pain is. You don't want to stretch it. I would not stretch the foot at all until your symptoms go away. And then once your symptoms go away, if you want to stretch it, go ahead and do it, as long as you have control of your foot coming from your brain.
Right. And I did learn, once I learned small foot, what Dr. Thoma is going to show, I was able to stretch my calf, but I had to do small foot while I was stretching. And if I wouldn't have done that, I would have been kept making it worse, because it was totally stretching the muscle yet again.
Yeah, totally. Hey, I'm going to go grab a block real quick.
Okay. So we couldn't figure out how for him to come to the broadcast through his phone, so he's doing it through the computer, and it's basically he has to stand on the desk to show the demo. But it's so important for you guys to see the demo.
Hey, so do you want me to go ahead and show it?
Yep, go ahead. This is it. This is the holy grail of plantar fasciitis healing. Can
you see it?
I hope so. I'm going to hide your name, and maybe they can see it better.
Here, this will work now.
There.
Yeah.
Okay, yep. Okay.
So what we want to do is we want to take the ball of the foot here and then the heel right here, and just shorten those 2 points just by doing that. So that is me doing the small foot, and then that's me relaxed. Small foot, and then relax.
So I hope you ladies can see that he's flexing that muscle in between the ball of the foot and the heel. And it takes practice. So what would you suggest the best way to start going about this?
As with most other things, just execute. Just do it. Just do it. What we typically give patients is you just accumulate 5 minutes per day. You don't have to do 5 minutes all at once. That's what I did when I had it in the first day. When I woke up the next morning, it was pretty much 90%. So accumulate at least 90 minutes. And here's the thing: it's really hard to overdo. It's really hard to overdo small foot, like it is to overdo like squats or deadlifts. So you really, if you have plantar fasciitis, I wouldn't sweat it if you are doing it for like 20 minutes. It's hard to overtrain those muscles and cause issues.
I do want you to go over, especially about how you do it with bunions, because I personally don't have control of that big toe. And you kind of taught me a little bit. Oh, do I do them one at a time, seated or standing? It's much easier to do it standing. If you don't know how to do small foot, it's going to be very difficult for you to do it seated at first, but you can do it once you get the hang of it. Correct, Dr. Thoma?
I actually find that it's easier to do it seated. But everybody's so different. Everybody's so different. And then I think the other question was they wanted to know if 1 or 2 feet.
Do them one at a time, or seated or standing.
It honestly doesn't matter. You have to gain control of your foot, like making sure that they can contract at the same time and then contract in an alternating fashion, because walking is an alternating fashion, and you should have at least some form of foot activation, small foot, when you're walking. So for me, it's I can pretty much activate at any time now. But I know a lot of people, if they do both at the same time, it's just easier because of there's probably something going on with the brain.
But I want you to talk about if you have bunions and you're trying to do small foot, explain that process, because I have them bad.
Yeah, so there are a couple different ways that you can do small foot. if you have a bunion, what ends up happening is this big toe goes laterally like that, and then this bone sticks out here. That bunions are actually secondary to the foot not working. If the foot works, then what happens is you have this anchor here, and it keeps that toe in a good aligned position here, and it doesn't deviate laterally like that. So if you have bunions, you've got to get on this small foot. And if you have bunions, it's going to be an uphill battle for you, but you just got to do it. I do think that if you start to see the bunions and you do small foot, you're going to prevent bunions from happening. Something that I've been toying with a little bit recently is when someone does a small foot, trying to spread the toes as they do the small foot, spread the toes. And there's a muscle on the side of the foot right here that actually pulls that toe out. People that have bunions typically cannot activate this muscle in the foot. If you do small foot, you'll typically feel that muscle contracting. If you have a bunion, it's just going to be a little bit lengthened, and you got to just shorten that muscle down, and that toe will come back. Bunions are tough. You just got to go at it. It's just like anything else. If you have any injury, you just got to go at it.
Well, I just wanted to share. I felt at the beginning, it was easier for me to do small foot if I lifted up my toes and then squeezed. So that's kind of what I was getting at. Will you show that real quick? I know it's awkward with the blocks, but
that's another strategy that we use sometimes. What Hillary's talking about is doing this. So you raise up on the toe, and when we raise up on the toe, we actually get raising of the arch here, which if the arch rises, then that means that you're contracting the muscles that connect these 2 points. So you can do it this way. Raise the toes up like that, and then what the ultimate goal is to keep that. Do you see how I'm keeping that into that small foot position? What we need is the foot to work independent of the toes. So that's another cueing strategy that can be used, is to get the muscles in the feet to work just by pulling up on the toes.
Okay. And then we had another question. Do you recommend a certain type of shoes? Which is a good question.
No shoes. No.
Yeah.
Well,
you did recommend that to me.
Shoes with the least amount of support. On Tuesday, Hillary was talking about she has these barefoot shoes. I believe you have New Balance Minimus, correct?
Mm-hmm.
Yeah.
Yep.
Any type of minimalist shoe is going to be awesome. Ultra doesn't make a minimalist shoe anymore, I don't think. I know New Balance makes some minimalist shoe. The thing is, though, if you've been wearing super supportive shoes and you have a chiropractor or a podiatrist that's put you into orthotics, that actually inhibits your brain from working because you're basically casting the foot, and you go and you wear the New Balance Minimus and you do like a run, your foot is probably going to be sore, and I would watch overdoing it. What I would do is wean yourself off of wearing the super supportive shoes and your orthotics and start just lightly, maybe like at first just wearing the minimalist shoe or barefoot one day out of the week, or just don't wear any shoes like throughout your house. Just be sure that you're doing the small foot exercise. So then, because ultimately what we want to do is we want to be able to control our foot when we're walking, when we're running. So yeah.
Right. So someone made a comment. I don't know if it's Kim. I can't see who's making the comments with this application. She said barefoot is too painful. Well, yes, it will be too painful right now. But she said that walking barefoot's too painful, but she needs to do the small foot and get that going first. Totally. And then go barefoot. But I promise you, when you're wearing shoes with tons of support and wearing orthotics, it's a Band-Aid. It's a crutch. It's holding your foot in that position. And what you want to do is train your brain and your foot to go in that position, because if you don't, then you're gonna never solve the problem. She said, I'm wearing the UFA's brand sandal, and I suspect that's a really highly supportive sandal. So do you have something to add,
I don't
Dr.
know. What
Thoma?
is it called?
I don't know the brand. It's OOFOS brand sandal. I've never heard of that, but
Here you go. I'm looking it up right now.
oh, this is Laura. Laura, what kind of sandal? Can you describe them? Like, are they super supportive or are they flat? I'm waiting for her comment.
Okay, I think I see. I mean, that's a brand. It looks like, and I'm not a huge fan of flip flops because um, I'm not a huge fan of flip flops because what happened when you wear flip flops, your toes have to grip so the flip flop does not fall off. And I wear them like when I go to the beach, I wear them, but I try not to wear. I try not to wear flip flops. If what you they do make some barefoot sandals, but they're like really dorky looking. I forget. They have like a strap on the back. They have a strap like on the back of the foot. It looks like caveman sandals, and like they're not cool right now. So I don't know if you guys really want to know. If you guys want to know, I can figure it out and I can pass it along to Hillary. Don't wear them.
She said more of a flip flop with a curved footbed. So to me, that's equaling yes. It's giving you support, and it's not teaching your brain to work with your muscle in your foot.
Totally.
So you need to do the small foot many times a day, up to, he said 5 minutes. And if you are consistent with that, you will be able to wear barefoot. I do wear flip-flops. You never like my choice of footwear, Dr. Thoma, but I do now. I walk around barefoot. I wear flip-flops. Like, I do not have pain from my plantar fasciitis when it was almost crippling when I went to Dr. Thoma.
That's the thing. If you learn how to control your foot, you have so much greater buffer area that you can wear flip flops and you can get away with it. It's like I wear flip flops and I get away with it. I don't wear them a ton, and I'm actually wearing. I don't even want to show you guys my shoes right now. I'm wearing them for a different purpose. I had an injury. They don't. I don't have a huge arch support, but like the heel is kind of high on them.
Yeah, I think I saw that. And then we touched on Tuesday, and I want to touch on it again about how I did heal my plantar fasciitis wearing heels to work. I think at the beginning I wasn't, but it is not heels are not your friend with plantar fasciitis. I'm sure you guys have figured that out already. But it lengthens the foot even more, and then when you take them off, it's like so painful.
So what happens biomechanically if you wear heels is this. So if you're in a heel like this all day long, the calf shortens. Since the calf connects to the heel here, as well as the foot muscle, the muscles in the feet, the intrinsic muscles of the feet connect to the calcaneus. When you take that heel away, that calf then lengthens and it pulls on the calcaneus. If it pulls on the heel, the calcaneus here, then what ends up happening is it's going to have more of a stretch on the plantar fascia. So heels, and like we said, like there's a greater buffer. If you know how to control your foot, you can wear heels and you're going to get by with it. It's not the best thing for you though.
Right. I sacrifice. I went through the pain for fashion, but I mean, I don't recommend it to everybody. But you can no more Laura, no more competition shoes. Those really killed me with my bunions and stuff. The competition shoes, but I did heal my plantar fasciitis, and I wore heels, but it's just not recommended. Is there any other questions? Is there anything that we covered on Tuesday that we haven't hit on, Dr. Thoma?
I think the only thing really is just like we talked about stretching of the calf muscle,
Mm.
and if a lot of times PTs, chiropractors prescribe stretching the calf muscle. If you stretch your calf muscle without doing small foot, you're lengthening that fascia. So if you are going to stretch your calf, um, some people need to. Some people have a shortened calf muscle, and they can benefit from stretching their calf. But if you if you are going to stretch your calf, then we highly recommend that you create that small foot contraction in there.
Yeah, and that's what I did. So, but you need to get, excuse me, you need to get the small foot first and then add it to your stretch.
Yep.
So,
And then our challenge to you is if you go out and
right.
hike, what you're going to do is do the entire hike with small foot. If you can do the entire hike with small foot, you own small foot, and you will not get plantar fasciitis. Oh, one other thing.
Okay, so that
we actually had a patient
yeah.
who had plantar fasciitis. We gave him small foot, and it helped him only like 50%. And it went on for like a month, and then he actually ended up getting a referral out because he had some blockage in some of his veins in his calf. And once he got the veins in his calves fixed, his plantar fasciitis got even better. So that's one case where plantar fasciitis, the small foot, didn't help 100%. But pretty much every case that I've ever had, I think he's the only one that we've ever had that did not get better by doing small foot 100%.
Okay, but it was because he had an exacerbating condition, and once he got that taken care of, it did work. There's another comment. Are calf raises done during a workout a no-no when you got plantar fasciitis?
If you keep small foot, you can do anything you want. And you should. Yeah. No matter if you have plantar fasciitis or not, you should be activating the muscles in your feet. They were designed to work. So like if you can't do small foot, calf raises are definitely out the door. But if you can do small foot and you're not symptomatic, then have at it and do some calf raises.
I will add, when I was, learning small foot and still healing, it was essential that I had those barefoot shoes, and I actually have some from Merrill as well. Those are the ones that you suggested for me, Dr. Goma. They're a little more attractive. I do not like the ones where your toes go into the like they're like fingers, like a glove. So it is so critical. And so I had to do small foot while I was doing heavy lifting. So I was doing squats and deadlifts. If I did it, I was in a lot of pain. So having those shoes helps you grip the ground better and get that small foot. If you're wearing like really supportive running shoes, it's really impossible to do it, I think.
Totally. And do you find that it's easier to do small foot when learning it? Do you find that it's easier to do it with shoes on because you have the top of you have the shoe, like the tongue of the shoe that's pushing down on the foot? Does that help you?
No, I liked doing it barefoot. I really needed to do it barefoot to kind of see and feel. I actually found it more difficult, but others might not.
With the people that I've worked with, most of them say that it's easier to do with shoes on because it gives them an input. But here's the thing: that's a crutch because that's an external source of resistance that you're pushing against. You have to learn to do it barefoot. You have to learn to do it in all environments.
Oh, someone asked me what Merrell's. I'll post a picture of the Merrell's in our group. I've had several pairs. They have all different kinds, but I'll post a picture of the ones I have now. I have like 3 different pairs of kind of minimalist shoes that I wear interchangeably.
That's right. The Merrells are called trail gloves, I believe.
Yeah, I know, and they've changed the styles. I mean, it's been years now that I've been getting different ones. So,
what are comp shoes?
Oh, well, competition shoes. They're for bikini competitions.
Got it.
They look like like Barbie shoes. They're like lucite heels. They're clear and they're so uncomfortable.
Got you. Got you. They're the recipe for plantar fasciitis.
Yes, yes, they are. But beauty is pain. So I'm not seeing any other comments come through. I did want to add, we do plan on doing diastasis recti, but we thought we should just focus on one imbalance today, and then we will go for future broadcasts talking about different ways or different injuries or things that you can heal through exercise. And I did want to add, we'll get to diastasis recti. Oh, Booker shoes? Oh, hooker shoes probably is what she was meaning to say for the competition shoes. I do want to also in a future broadcast go over back pain, because Dr. Thoma, you've helped me with so many injuries to my back, and one very major injury where I could barely even sit. I was in so much pain or lay, and you've truly worked miracles.
Awesome.
So, all right, I think we're going to sign off for now, and stay tuned for future scheduled live videos going over these other topics. So, Dr. Thoma, do you have anything to add before we sign off?
No, it was awesome.
Okay.
Do your small foot.
Our call to action is do small foot and post a picture of you doing small foot in the group. And then
any challenges that you have? Any challenges that you have with small foot? Post them.
Yeah, we should do a small foot challenge. I'll have to think about that. But I will also post Dr. Thoma's information for Infinity Spine. He's located in North Scottsdale off of Raintree and the 101 if you're in the Phoenix area and you would like to see him in person. So
awesome.
Thanks everybody for tuning in, and thanks Dr. Thoma.
Thank you guys.
Okay. All right. Take care. Bye.